Hi, welcome to BariNation, where we support the bariatric community with humor, humility, and honesty.
You've just tuned into a podcast that welcomes you into a community, a resource center, and a safe place that powers your journey towards personal wellness.
Our goal is you leave us today feeling hopeful, inspired, and ready to live your best bariatric life.
Hey, BariNation, it's April. Today, you are going to meet Nina Crowley, an amazing practitioner who has been working with bariatric patients for about 2 decades. She's currently the Clinical Education and Partnership Director at SICA, and that's a company that makes body composition technology. We know body composition is extremely important, and the more research that comes out about it, the more importance it really has to take in our life. We actually met Nina at last year's ASMBS conference, and at the time that this podcast episode is airing, we're about a week out from attending this year's conference in Washington, D.C., where we've been selected to speak on how revisional patients can lift shame and stigma around the procedure. It's so important that we attend these big national events. BariNation is an educational platform, and we need to be where the research is being discussed, where the clinicians are, so that we can help make those connections between the surgical world and the patient world. So I hope you enjoyed this conversation with Nina. We're so excited for you to get to know her, and we're thankful for your support as we head off to Washington, D.C. to represent you, bariatric patients, at this year's ASMBS conference. Hello, friends. Welcome back to the podcast. Today, we have an amazing guest that you probably have never met before, and we are going to be talking about something that we know is top of mind for you, body composition. What is it? Why does it matter? And where do we start? But before we get into the conversation, I want to introduce you to Nina Crowley, who's going to be our guest today. Hi, Nina.
Hi. Thanks for having me.
Thank you for joining me. Before we jump into the conversation, will you take a moment and introduce yourselves to our friends, listeners, and watchers who don't know you yet?
Sure. Yeah. So I'm Nina Crowley. I'm a registered dietitian by training. I have my PhD in health psychology, and I'm a former bariatric surgery program coordinator. I worked at the Medical University of South Carolina here in Charleston, South Carolina, where I still live, for 17 years, 10 as a dietitian, 6 as a coordinator, and 1 because that's just, I aged as that. It was a stressful role at the end there. So 16 years. I was there 16 years. And now I work for a company called SICA, which makes body composition equipment. So we will get all deep into body composition. I'll tell you all about that. I've been with SICA for 3 years. So I love this space. I love all things, obesity care. I'm a big advocate for patient access, support, education. I talk a lot about weight bias and stigma. I've been on the board of the Obesity Action Coalition for the past several years. So I've really stayed connected to my patients in that way. And so I'm happy to be here talking to your audience.
We're thrilled. And every time I talk to you, I learn something new. And I so appreciate the different perspectives that you bring into each conversation, right? Because you're talking about it from almost that lived experience, from the experience that you have with the patients, and now the experience that you have kind of on the industrial side of the bariatric world. And you bring all of those together and you help us understand some really complex issues in ways that just make sense for us. So thank you for that.
Thank you. Yeah, I did not think I was going to be able to use all that psychology and behavioral stuff in this role. It felt very technical and scientific when I started, but it turns out communicating about body composition effectively is just like communicating about weight and obesity and health. There's a lot that to do it well and to do it effectively, there's a lot of behavioral psychology stuff in there.
Yep, absolutely. Well, let's just jump right into this conversation. So we hear body composition absolutely everywhere now. So let's kind of start with the basics. What is body comp or body composition?
Sure. So yeah, first of all, I'm super excited to hear you say that you and patients and people who, are living with obesity have been hearing a lot about body composition, because that has not always been the case. And so, as you heard, being in this field 20 years, it's something that I really feel like we should have been doing a whole lot more, a whole lot sooner. But the technology has really advanced. When I was in school learning about nutrition and obesity and all of that, we learned a little bit about a lot of different methods to assess someone's body composition, which is the makeup of what's inside. So in essence, we're really looking at kind of breaking that into typically fat mass and everything else, which we call fat-free mass. And then we sort of take that fat-free mass and kind of come down from what that's made up of. We hear lean body mass, then we hear skeletal muscle mass, there's water, there's bone, there's connective tissue, there's skin, there's all sorts of things that your body's made up of. But primarily we're looking at wanting to understand sort of how much of your body is made up of fat molecules and how much is made up of everything else. And then from that everything else, we want to sort of look at maybe the tissue level of what is adipose tissue and what is, in particular, visceral adipose tissue, the stuff around your organs in midsection, because that's the part that's most unhealthy. So kind of measuring and understanding that. And then also from a tissue level, your skeletal muscle mass, right? So we talked a little bit about, a DEXA scan is one way that you can assess body composition. That way gives you that fat mass, the bone density that you have, and the everything else. That everything else is called lean soft tissue or lean body mass. But even further from that is the skeletal muscle. And so from that, you would look at imaging like an MRI to be able to tell you what of your body tissue is made up of skeletal muscle. And that's really the stuff that we're working on, wanting to preserve, wanting to grow, wanting to keep active, because it has impact on our metabolism and how we burn calories. So there's a lot of reasons why we want to keep that skeletal muscle mass. And as we age, we talk a little bit about the menopause transition years, which is a long time. That's a big one, and as we're aging, the numbers kind of shift, right? So big picture body composition is really looking at what your body's made up of. There's a lot of different ways that tried over the years to do that. Old school ways like underwater weighing, research things that like take all day, right? So the best way to estimate your fat mass is by looking at something called the 4-compartment model. And that's looking at, 4 different ways to test. It's an all-day thing. It's really only done in research to get a measure of that. But then we take measures like bioimpedance, which is what I do now in my role with Sika. We have bioimpedance analysis. That's the technology that we use. We take that and we validate that, meaning we run somebody's test on bioimpedance and we run them through that all-day 4-compartment model testing, and we see how close those numbers line up. And we're looking at, 97, 98% agreement, and we feel very comfortable that that's good enough. And like we were talking about earlier, it's nice for that to be something you step on in your doctor's office or in a clinical situation. You get there, you get the numbers in less than a minute. You can talk to your clinician about it that day and be able to make some changes right on the spot. So that's what I really like about bioimpedance. And that technology, the way it works is it's looking at a low dose electrical current that goes from the feet through the hands. So you step on it without shoes and socks. In less than a minute, it's sending through that current, and the current goes through fat and muscle and water at different speeds. And so it takes all of that data, and there's some, high level predictive formulas that they use to figure out, at that speed of that impedance, or the slowing down when you're going through fat tissue and the speeding up when you're going through tissue that has more water, like muscle. Those come into formulas, and then they give you an output which would show you this is how much fat mass you have, this is how much muscle mass you have, and total body water and some of these other parameters. So that's it in a nutshell. I talk a lot about bioimpedance. I think as a person who you heard as a clinical practitioner, I ran a program for years. I think it's the best that we have right now to do point of clinic testing, being able to give someone those results right away. There's a lot of work that kind of goes into if you send someone out to get a test, and how are you going to talk about it? Do you come back to the clinic? My goal was always, how do we do the most amount of work right there, right then, when it matters, and then be able to send you off with some practical things to do in between.
Definitely. And as a patient who has recently had a lot of testing done, I cannot stress how powerful having this data has been in my personal bariatric journey, right? It's one thing to step on the scale and get a piece of data. And I gave so much weight to that singular piece of data, right? My gravitational pull towards the earth was most important in my life. But now that I'm aging and I'm experiencing different medical diagnoses, having the understanding of what's actually happening in my body to the things that I can't see has allowed me to make very different decisions about what I do with my body and how I treat my body, the things that I put into my body, because that is actually the most important data, not necessarily my weight. And I think that's why we're hearing about this now. All of a sudden, it's like, why is everybody talking about composite, body comp? Why is it everywhere? And really, it comes down to what our body looks like on the inside is almost more important than that one singular number. We can make so many more health decisions when we understand what our individual body is doing versus just what our weight says.
Well, and even, we talk a lot about how it's not appropriate to just do weight and BMI anymore. And it's not appropriate to give them the counseling of, you just need to eat less and move more, right? But we also know, a lot of times people would say, well, we just need to strength train. We just need to eat more protein. And so, that's probably the advice that many of us need. But just telling someone what to do and just having, simplified advice does not connect to people actually doing it. But I think in your case, what you're getting at is seeing your own data in that way. Like, oh, wow, maybe my muscle mass is lower than I would have thought. And maybe my, body fat around this particular area is higher than it should be. Those are more concrete sort of data points that I think really can help strengthen that. Okay, it's not just general information, eat more protein, whatever. It's for me, this is what I might need to do to change that around. And then, connecting that to what are the reasons for making those changes. And I like it too as an experiment, right? Like I would always, as a dietitian, talk to patients about, there's lots of advice out there of what to do and eat. There's plenty of people willing to give you that advice. But let's work on something together, send you off into your life for a month or so and come back and see how things have changed. Back then when I was doing it and did not have body composition as an assessment measure in my clinic, it was, well, how do you feel? How are things going? And then of course you do still have to get on that scale. So it was disjointed. And now I feel like we can make those sort of experimental recommendations. You go off and you work on it. And, maybe a month or two later, you are able to see some small shifts in the composition, lower fat, higher muscle, if that's, where we're going. And that can be quite motivating, and it's individual. It's about you and your progress, not your friends, not your, people you see on the internet, which can be so influential, but it's nice to look at your data.
It is so powerful to look at your data. I'm the type of person that, my voice in my head will talk me out of doing anything because it will always tell me, yeah, but that was somebody else, but that's general information. And you don't really know if that's going to work for you. When I got my individualized data, there was no more refuting it. All right. I had something to go back to that voice in my head and say, hey, guess what? This is actually you. This is you on the inside. This is what your body is doing. And now you have very, individualized information that you can't deny. So it was really easy for me to just kind of put that voice in the back of my head on the back burner and say, okay, now I do have the evidence that I can move forward with to start making some different decisions.
Yeah. And I think, you asked a little bit about like, why is it popular right now and all of that. And I think, again, I've been in the field almost 20 years and I've said from the beginning, it's more than just about weight.
Yeah.
We've heard that message, right? For years.
Yes.
But then all you would do would be come in and get on the scale and get a weight, right? So it's like, it would be this disconnect between what we're saying and what we're doing. And so I think the, kind of coming about with medications now where there's more people who are in this space. It's not just the, I think people had a tendency to other the surgical realm. Oh, that's different. You're not, now it's all of us. It's 70-something% of people. So there's no other, right now. And so I think because it's so ubiquitous, everybody's talking about it, I think that's brought it to light a little bit and made it a little bit more tricky to just prescribe a medication and not measure the thing that we're saying, well, we hope that doesn't happen.
Thank you for saying that. Yes, right. We've always heard this, but yet the only form of data that we were given by our primary care team was our weight. So this is a powerful shift that we are now in control of, which is really kind of my last question for you. So where do we start? If we want to understand what our body is doing, looking like, and is composed of on the inside, where do we begin?
My patients have always been, and I'm sure your listeners can be perfectionist thinking, a little bit all or nothing, right? So I think we have to always be fighting against that. There's many ways to do this. Every clinic is going to be a little different. Some providers may have body comp in their office, some may not. There may be referrals available to, centers that have other types of imaging. So I think we've got to start with just, like, my goal is that we start talking about it and offering it at some level. Of course, in the end, I think, we have a great product that I hope people use, but I think the conversation should start with just what's available and how can we get this type of testing to the majority of folks. And so some people are starting to do, anthropometric measurements. So like a waist circumference to measure that as it relates to, your visceral adiposity. That's one that we don't have time to talk through today. That's something some people are doing. But I think more than that, we're seeing more of the bioimpedance in a clinic. So if your doctor has that, not just your doctor, but your care team has a bioimpedance scale in the office, that's a really great start. But not everybody has those right now. So one of the things that I've done is really worked on I've written so many letters on the prior auth side and the dear insurance company. Why are you so, unempathetic? This time I got to write a letter that was like, if I was a patient asking my doctor to cover or to purchase or to figure out a pathway for me to have bioimpedance or body comp testing in the office, what would I want it to say? So I've crafted a letter that I can give you access to on our website for your show notes so that we can offer that. I would say download that, fill in your story as much as possible, but show your doctor or your care team that, them just telling you it's more than just weight, but not showing you what that means is a discrepancy, and that you would like to have access to that. I think that's a very concrete way for a patient or person living with obesity to take control over that narrative. Now, if it were as simple as a letter convincing someone to do that, that would be fantastic. But we know that that's just probably the start of a conversation. That's one thing to do. There are some other, kind of centers that have, a DEXA scan is something that can measure both your bone density, and they have some that have software to look at your body composition. So that's going to give you lean mass, not as specific as the muscle tissue, but the lean mass is a number that, that could be, a way to get started in the body comp realm. So there's ways that you can get to that. Sometimes there's research studies in your area that, could offer that. That'd be a way to look at some data there. And then we also do have some in gym settings or fitness center settings. So, we have Crunch or YMCA that may have our device there. So some of those are a little bit more open to, hey, I want to come in and do this. Some other gyms have some of our, maybe competitors. And so that would be something to look around, like in your area. Is there a place that offers body composition analysis in any kind of way, shape, or form?
Oh, awesome. So what we'll do in our show notes, friends, go ahead, absolutely look down through there. We will connect you with the letter that Nina is talking about, so you can fill it out and send it to your doctor. But we'll also kind of provide you with a little bit of a cheat sheet that you can download that will kind of summarize what you can ask, who you can call, kind of where you start this process, because we know it can be a little bit overwhelming sometimes. So we'll make sure that we provide that in our show notes as well.
Great.
I just know, and I know you know, right, as a patient, as somebody supporting patients, this data is so critically important, and it really can make a huge, powerful difference in our bariatric journey. So we want to make sure that you know where you can start if you're ready to go down the body composition road.
And here, this is just the beginning, right? So once you get the data, I've got lots more to say about how we can interpret that, how you can, craft your own kind of goals and work with your provider on moving, towards improving some of those metrics. But for just to start, I think the awareness of this being an option and the push and the ask to your care team to figure out how to offer you that level of data, I think that's really impactful and important.
Yep. Oh, phenomenal. There's already 8,000 questions that I want to ask you, but we are out of time. Nina and I are going to keep the conversation going, though, for a bonus episode of this conversation. So if you are a member of BariNation, you're going to find it there in the community. But Nina, thank you so much for joining us today. This is a wonderful introduction to what body composition is and why it is so important.
Thank you so much for having me.
That wraps up another empowering episode of the BariNation podcast. If you enjoyed today's episode, keep the conversation going by joining the BariNation membership community, where you can attend live support events, access on-demand resources, and find a caring community.
Join us at barination.mn.co. If you found this podcast valuable, help us produce it by becoming a $5 monthly supporter at barinationpodcast.com.
And just remember, at the end of the day, you've got this, we've got you, and we'll see you next time. Bye, everybody.